Today I want to talk to you a little bit about releasing tension. And those two words really speak loudly if you focus on them, is to release tension. And that is that somebody has some short tension. You have to be able to take it to its most stretched position so it can go beyond that. And the way that you do that is, I have found that there's basically three layers of the human body. And that is, that first layer is that muscle tissue, and muscle tissue has the ability to be in severe spasm because it's activated to try to hold the body up. So it's not something that you can just go ahead and just, be a brick and just, plow right through and just bash through. You have to chip away, chip away, chip away in a very linear way with your pisiform. Chip, 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 chip. Very small motions where the pisiform is just gently rolling, gently chipping away, almost like a little rock hammer chipping away at rock. Once that happens and you start getting a good contact and you start chipping away a little bit, you can start leaning in and you'll start noticing that there's some pliability in there. And once you get that pliability going, you start rocking into the muscle fascia, the muscle tissue, and before you know it, guess what happens? You start feeling the bones. And that's where you start hitting the bony layer. And the bony layer is very different than the muscle layer. So where the muscle layer, you're trying to create big motion moving through the muscles, the bony layer doesn't have that flexibility and that pliability. It has the motion of the joints. So you basically bend, 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 bend in small little motions and little kicks with that wrist lever. All right. So once you go through those areas, all of a sudden you start rocking again and you get into the deep layers of the dura, and that is where we restore all the three-dimensional motion. All this starts and continues and is a continuous process through when you start through that that muscle layer, okay, and that's hard. And that starts moving. So patient placement plays a very big role in trying to create tension. You can't create tension just with your body and your pisiform. So as you're going through your process, you are moving the patient and moving the patient, constantly stretching that rubber band and moving the patient, stretching the rubber band and moving the patient, stretching the rubber band and moving the patient. And if you keep increasing that tension, it allows you to do what? Go beyond that tension. All right. So two things to remember. Number one is never take more than what's given. And number two, always move in the normal motion of the human body. Never go against it. Peace. Have a great evening.